We have a super active R&D program. We have about 30 R&D projects in the pipeline.
Wow.
Yeah, super busy. Super active. And that's looking over the course of about a 10 to 12 year period. But 20 of those we're expecting to bring to market in the next 5 years. And that's new indications, new products, or new geographies that we're going to be entering with the products that we currently have. M&A, big area of focus for us. We're always looking. We have a very active platform where we are assessing a couple of key priorities and keeping an eye on things that are big, breakouts in the market. You're obviously going to be intimately aware of these, but something that can deliver on hair growth would be really key. Non-invasive cellulite treatment would be another big, huge breakout play.
Sure.
And just general regenerative aesthetics, exosomes, polynucleotides, that area we're staying really close to as well.
Hi, everybody. Before we get started on our next episode, I'd like to ask you a favor. Would you please, wherever you're watching or listening, would you please subscribe to our program, The Technology of Beauty? There's a little box you can check. And by becoming a subscriber, we will alert you to all new episodes. The other thing I'd love you to consider doing is if you go to thetechnologyofbeauty.com and join our mailing list. So go to thetechnologyofbeauty.com.
The Technology of Beauty is brought to you by Influx Marketing, the digital agency for aesthetic practices. Find out more at influxmarketing.com.
Hello, everyone, and welcome back to The Technology of Beauty, where I have the opportunity to interview the movers and shakers of the beauty business, and today is no exception. We are here in the studio today in beautiful Manhattan Beach with Bob Radigan. Thank you, Bob. Bob is the CEO of Merz Aesthetics globally. He's #1 for Merz Aesthetics in the universe. And I have been trying to get him in this studio for over 5 years. A little thing happened about 5 years ago called COVID. And Bob was on the program, but it was distant. He was in Raleigh. We're going to bring that up in a minute. And I've been waiting for 5 years to get him here. We've had so many CEOs, but none like Bob Radigan, the head of Merz Aesthetics. And here he is. He flew in last night to be on the program. We're going to get him out to LAX, and he's going to fly home. And Bob, heartfelt, thank you very much for sharing your time with us.
Oh, thank you.
We are so looking forward to getting to know you better and hear all about Merz and Bob Radigan. So first, where are you from, Bob?
San Diego. I grew up just 2 hours south of here and went to school in UC Santa Barbara, so kind of bracketed Manhattan Beach. I'm a gaucho.
But you went to high school in San Diego?
Yes, high school in San Diego, then Santa Barbara for college.
What year did you start Santa Barbara?
84.
Interesting. Okay.
Yeah.
And you're a gaucho. Did you graduate from UCSB?
Yes. Yep.
And did you live in Isla Vista?
I did.
Interesting. Did you live in the dorms the first year?
The dorms first year, and then Isla Vista, which was a world unto itself.
Yes, I know. I spent the summer of 1970 in Isla Vista. I was a student. I was a high school student, but I went to college between my junior and senior year. You may have seen young punks like me running around, skateboarding and on. I went to UCSB for one semester.
Crazy.
Yeah.
Well, I was a young punk there 4 years, skateboarding to class. And surfing.
I was surfing right below. I stayed in the dorms. Yeah, I'll be darned. I didn't know you were a gaucho. Yeah. Well, okay, so after you what'd you graduate in?
Business economics and law and society. I went to Procter & Gamble for 9 years. Worked there up in the Bay Area, then Minnesota, where I met my wife, Judy, who you know.
Yes, I do.
Then we were in Cincinnati, and then back out in L.A. Had a variety of different roles. Was in sales management, brand management, corporate account management with them.
And then didn't you work for David Pyatt at Allergan?
Yes. Yep.
Yeah. So when did you start at Allergan?
In 96. So Allergan, back in the very, very early days of Allergan. It was a probably 50-year-old company at the time.
Yeah, but it was
or
eyes.
close to
It was
but
eye drops.
Purely eye care, and that's how I joined. I went into eye care in the glaucoma business. Actually, in managed care, and then glaucoma. I ran the franchise that was the largest eye care franchise for them at the time before taking on Botox.
And did you report to David, Mr. David Pyatt?
No, reported to a different David Endicott.
Oh, of course, another friend of ours.
Yep.
Yeah.
And Mike Ball, David Pyatt joined probably about a year after I joined the company, or within 2 years.
Well, David's been on the program, and I've been trying to get David Endicott on, but Pyatt has been right here in this studio.
Awesome.
Yeah.
Yeah. I was there 17 years, and
Be darn.
Pyatt was there probably 15 of my 17 years. David Endicott about the same.
Yeah. Both great humans.
Really,
I love them
really
both.
good people.
Yeah, absolutely. Okay. So then, did you go from Allergan directly to MERS?
No, I stopped at I worked at a small startup called Alphion for a couple of years.
Of course.
3 years. Yep.
Of course.
A lot of learnings there. It was an interesting run, and then Mertz after that. And I've been at Mertz for 8 years.
What was your role at Alphion?
I was COO and president.
Okay,
Yeah.
Interesting.
Yeah.
Now, when you went to work for MERS, you moved to Raleigh, didn't you?
Yes.
Tell us a little bit about that. Southern California kid, a gaucho, a
Yep.
surfer, a fisherman. You've got this beautiful wife from Minnesota.
Yep.
As do I.
Yep.
And
exactly.
You go.
They went to adjacent high schools or the same high school.
Yes,
I can't remember. But
adjacent high
Aaron and
schools.
Judy did.
Yeah.
Yeah.
So you move her and the kids
Yep.
to Raleigh.
Well, we were empty nesters at that point.
You were already?
Yeah. Our
Okay.
youngest had graduated UCLA, was out of the house. So we were empty nesters, made it easier. 3 labs, we're
Yes,
big
of course.
dog fans.
Yes, as are we.
Yep. So we moved them, but I didn't know anything about Raleigh. I'd literally never been to Raleigh before
Okay.
moving there. Didn't know a single person in Raleigh, anything about the environment.
Wow.
Got the job offer and said, well, how about if we go out and do a site visit? I want to make sure I like the area.
Sure.
Before we commit to moving there. And it's been great. Love it.
How many years have you been there in Raleigh now?
8.
God, I remember when you went.
Yeah.
That's
Yeah.
crazy.
Yeah.
Well, we're going to get to that in a minute.
Okay.
So you've covered so much, you sales and different eye care, glaucoma, and all the rest. And now you're in the aesthetics business, right?
And at Procter & Gamble, I was in dental care.
Oh my goodness.
Yeah.
Oh, we're going to get to dental.
Okay.
I have some questions for you about
All right.
dental.
Yeah,
okay. So here you are, you're running MERS.
Yep.
And you have products, you have all kinds of products. You have capital in the form of Ulthera
Yep.
or Ultherapy, right? We'll get to that.
Okay.
You have fillers, right?
Yep.
You have a world-class toxin. Do you have topicals also?
We do, Neocutis.
Neocutis,
Yep.
of course.
Just in the U.S., not globally, but a U.S.-specific franchise for us.
Okay. So you cover a lot of aesthetics territory.
Yep.
Let's start with, say, Ultherapy.
Okay.
That's a capital item.
Yep.
Now, you used to have the guys, you acquired it, and it was in Arizona.
Arizona, yeah, Mesa, Arizona.
Mesa, and you moved the engineers to Raleigh.
Raleigh, yeah, just over a year ago. Moved the entire organization that was doing all the development in Mesa, Arizona, out to Raleigh. We built, which would be great to have you come out and see,
I can't
really
wait.
cool state-of-the-art innovation lab. So we do all of our energy-based device development now in Raleigh. It's a just state-of-the-art entity that we have there. Have all the engineers, software folks, hardware folks, soup to nuts in Raleigh now.
If I came out, would you allow me to take a tour of that?
100%.
I would love to do that.
Yeah, we'd take you through it.
So right now, therapy is mainly geared towards the face.
Yes.
Is that correct?
Yep.
Are you looking at any body applications?
Looking at body, actually just got body approval in the U.S., which we're going to be launching later this year.
Fantastic.
For arms and what was the other? Arms, and we're waiting on stomach. Stomach
Okay.
is going to come quickly.
You means abdomen, stomach is where the food goes?
Yeah.
We're not really changing the stomach. We're tightening the skin of the abdomen, especially after all that massive weight loss with all those shots and all. You know that drill. Okay, so
Thanks for
good.
the anatomical correctness
That's
and
okay.
precision.
That's okay. I'm here to help. Okay. Anything else you want to share with us before we move on to the next topic about Ultherapy?
Ultherapy Prime we just launched. We, for the first time ever, have launched an upgraded Ultherapy just in the last, it's been about 8 months, September
You were at
in
the
the
Aesthetic
US.
Society. I have my picture with me next to the new machine.
Yeah. And
so
it's been
why
awesome.
is it better?
It is faster, way better visualization. If you think about an old original iPhone versus today's, what you see in terms of visualization when you look at the screen, that's kind of old therapy or legacy versus the new one. Way bigger screen, way better visualization, which is key when you're trying to identify the different layers of tissue. So,
in terms of delivering the ultrasound energy, you can identify the SMAS or the sub-Q and all the different structures. Fantastic.
Faster, it's 20% faster procedure. Which makes a big difference and is a platform for a number of other iterations we have coming downstream. We're going to move into which has not been the case for us historically, but we're going to go into fast cycle innovation on all therapy with new things coming every year, 18 months max.
Wow.
Yeah, to keep it real fresh and advance the technology.
Excellent.
Yeah.
I love it. I have some questions about the app on the price point, but I want to move on.
Okay.
Yeah, I happen to see the new technology. What do you call it again? The
Ultherapy Prime.
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 Yeah, I knew it was a P.
Yeah.
Ultherapy Prime, the new device.
Yeah.
Yeah. I saw it at the show.
Do you like it?
I love it.
Yeah,
I love it. I love the technology. You know, I'm working with a company involved in ultrasound, so I know a little bit about ultrasound deliveries. So I'm very curious about it. There may be some partnerships there. Are you still using a very pretty woman as your spokesperson who loves pure products?
We have moved on.
Okay.
She is still someone that it's great to see in the news. You're talking about Christy Brinkley and Gwyneth Paltrow.
Right.
Yep. Historically, we actually right now are working with Salma Hayek on Ultherapy Prime. I didn't mention that, but she's a global ambassador for us on Ultherapy Prime. Really huge fan of the product, big user, and has been great to introduce with the new product.
And is she using the Xeomin? Is she the spokesperson for that also?
Just Ultherapy Prime.
Just Ultherapy Prime. Mm-hmm. Yep. Okay, fantastic. Yeah. Well, congratulations. You have a couple of fillers.
Yes.
And they're very different.
Yes.
And we think filler, but you know, one's a biostimulator and one is not. And one's hyaluronidase and one is ground up coral, so to speak, hydroxyapatite. But why don't you tell our listeners and guests a little bit about your two fillers? Yeah,
they're very different. Radius is the biostimulator that you mentioned there, which is calcium hydroxyapatite. And then we have a classic HA, which is Belotero.
HA is hyaluronic acid.
Yeah, thank you. In the U.S., we have Belotero Balance, but we're soon going to have a broader portion of the range because globally we have a more built-out range. We have Belotero Balance, Intense, and Volume for different utilizations. You know,
are they different G
depths.
primes?
Yes. Yep. Different depths, different functional characteristics of the.
That's interesting.
Yeah, the product.
So G prime refers to the viscosity. Okay, so if it's really liquidy, kind of like car oil that's 5 weight, that's low viscosity, a low G prime. If it's really thick, like 50 weight motor oil, it's high G prime. So he's going to have 3 different viscosities, or we call G primes. Yeah,
and they're, as you know, I mean, they work well depending on what depth or level of the tissue and face that you're injecting into. So
if you want to take care of these wrinkles around my eye, you would want a low G prime, right? But if you want to augment my jawline and go to the bone, you'd want a high G prime. Mm-hmm. That's the point.
Yep.
So you're going to offer all 3.
Yes. Yep. And we've had them globally. Globally, we have a great HA franchise, really good market share. U.S. has been the market for years where we've been underpenetrated in that regard.
Well, that's exciting.
Yeah. Looking forward to that.
Interesting. Okay. Yeah. Tell us a little bit more about Radius and the idea of biostimulator. What exactly do you want them to understand about biostimulation?
Well, Radius has been booming. It's been, number one, the category biostimulation is growing faster than the hyaluronic acid category and has been for the last couple of years, is expected to continue to be going forward as well. But the layman's version is it helps your body do what it naturally does when we're younger and starts to grade over time, doing in terms of production of collagen, elastin, et cetera. So Radius helps stimulate that natural physiological response.
Okay. And where can we put it? Where are you approved to put it?
So face, but also décolleté. We've been approved in Europe just recently to inject into the décolleté with a dilute Radius.
In terms of looking at stuff from an R&D or M&A, mergers and acquisitions, What else is on your table, if you can share with me?
Yeah.
Are there things that you can share that you're kind of interested in or looking at or about to announce?
Yeah, sure. R&D, we have a super active R&D program. We have about 30 R&D projects in the pipeline.
Wow.
Yeah, super, super busy. Super active. And that's looking over the course of about a 10 to 12-year period. But 20 of those we're expecting to bring to market in the next 5 years. And that's new indications, new products, or new geographies that we're going to be entering with the products that we currently have. M&A, big area of focus for us. We're always looking. We have a very active platform where we are assessing a couple of key priorities and keep an eye on things that are big, breakouts in the market. You're obviously going to be intimately aware of these, but something that can deliver on hair growth would be really key. Non-invasive cellulite treatment would be another big, huge breakout play.
Sure.
And just general regenerative aesthetics, exosomes, polynucleotides, that area we're staying really close to as well.
The other thing, which kind of circles back around Emerge potentially, is there a way to accelerate the transcutaneous delivery of the exosome? We know that all the exosome companies, they have a topical. And the idea is we hope it gets through the stratum corneum and we hope it gets into the deeper dermis and so forth. We have other hopes too, potentially.
Yeah.
But there are some products, in particular one, that could potentially take it right across the skin. And that's the product that Ryan Beal has, which is Dive. And he's been on the show a few times. It's very interesting technology. Imagine if you could take the exosome, like the autologous, your own exosome, not from a piece of celery, not from a pig, not from some other human, but rather your own exosome. Imagine if you could put that and deliver it to your system without a needle.
Yeah.
It's very exciting.
Absolutely. Or neurotoxin.
Or, there you go. That's what I was going to say. So I would encourage you to look into this stuff, Dive. Look into Ryan Beal's thing. He's been at AIS, as I mentioned, and I know Jonathan knows him. I know Patrick knows him, and I think you've met him before.
Yep, I have.
But great guy, and he's a physician by training. I encourage you to watch his Technology of Beauty.
Yeah.
Because he's a mover and shaker.
I've seen him previously on it.
Okay, cool.
Yeah.
Yeah, and he's a great guy.
Yeah.
I hope you and your people running all your M&A look at him. Okay,
Take a close
so
look.
now, we've talked about the here and now. We've talked a little bit about the future.
Yep.
Because you're looking, you said, down the line.
Yep.
It sort of takes this question. But if you look at your crystal ball and you say, about aesthetics, 1 year, say 5, 10, even 15, what's it going to look like? You and I have known each other for 20 plus years.
Yeah.
And you've seen a ton of changes. There wasn't even Botox when you started.
Right. I launched it.
There you go. You launched Botox. Who would think you'd put a toxin on your face to get rid of wrinkles?
Yep.
Give me a break. Who would ever do that? Lockjaw? No way.
Snake venom, people were calling it at the time.
And then here we are.
Yeah.
2025. We're talking about 2026, a few things coming out, a few versions of Belotero. You've got a new therapy. You're going to start looking for indications in the body. You've run through a few things. What's the world going to look like? The aesthetic world.
So I think a few things. One is, and we've already seen this, but a lot younger patients on the market. Remember, 20 plus, 25 years ago, it was pretty much 45 and up. 45-year-olds were probably at the low end of who was, walking in the door. But now it's 30 and up, and the fastest growing demographic is actually 30 to 40. So I think the patient demographic's going to go younger, continue to do that, and that's largely because people are focused on self-care and including medical aesthetic procedures as part of their self-care regimen. It used to be, back even again 20 years ago, it was kind of the indulgent luxury, that people would get that are on the red carpet, wasn't seen as a product for the everyday woman or the everyday man, and that's shifted dramatically. We just did a study, huge study, 15,000 patients across 15 countries, and 70%, probably a little bit more than that, but roughly 70% of the patients said that they are treating medical aesthetic procedures as part of their ongoing beauty or self-care regimen. That's a huge change towards normalizing.
And though, is
these
that just
procedures.
women, or is it men and women in that study?
It was men and women, but predominantly women. It was
Sure.
about 85, 90% women, which is pretty representative of what the patient base looks like. So that's going to be one thing. I think younger patients, I think we're definitely going to have injectables for hair growth. I think that will materialize 10, 15 years. I think it's going to be real at that point. Exosomes, there'll be clinical pathways, the FDA, and you talked about FDA Canada or the regulatory body up in Canada. It'll become more and more possible to get products like that approved for different indications in the market. Cellulite we talked to, I think there's going to be more non-invasive, effective cellulite options, not that treat one aspect of cellulite, but the whole kind of multimodality aspect of it. So lots of good things. And, fundamentally, I think the two big things that we see today, which are neurotoxins and dermal fillers dominating the market, I believe that's going to continue to be the case. They are the easy entry points, even for people who are needle phobic, like we talked about. It still is the thing that is most commonly bringing people in. That's going to continue to be the entry point to many, many other procedures in the space that will include things that we just talked about that don't exist today.
We all want, number one, we want patient safety.
Yes, absolutely.
Patient safety is first and foremost. So anything that we can do to increase patient safety, we should. And in general, injectables are very safe. As long as they're in the right hands, the right training. The person needs to know the anatomy. They need to know how to properly administer it, the depth to administer it, and so forth. There are these devices and technologies that are coming out right now to look through the skin and see, am I in a vessel? Am I close to a vessel? And I'm aware of them. I have no personal interest in any of them, okay? I have no personal interest, for once. But I do worry about intraarterial or intravenous injections. Is that something that you'd be interested in, or are you doing anything along those lines?
We're not doing anything. That's something we would look to a partner for.
Okay.
And perhaps even from an M&A, merger and acquisition standpoint.
Good
look
job.
to potentially bring in to the fold. Because as you said, training is key. Understanding the anatomy, critical. Every patient's so different. It's definitely not a one-size-fits-all model that you can apply, as much as people would love that to be the case. So anything that enhances patient safety, I think, is going to be great for the market. It's going to help bring in a lot more patients, reduce concern about side effects, potentially as significant as the ones you just described, and really help build the field overall. So anything that helps people more safely inject or treat a patient is a very high interest to us.
Good, and I would think so. And I would hope it'd be industry-wide.
Yes, me too.
I would hope that every one of the majors, with MERS leading the way, if we could agree, and maybe there'll be multiple. This one technology I saw, the one that was in Paris at MCAS, is ultrasound driven, and the injector wears it on their finger, and they sort of see underneath the skin.
Oh, interesting.
With the addition of ultrasound. The one I saw yesterday, it was presented to me, uses light. It's a light-based, and it's on the syringe. It's on the needle. And if you're in a vessel or around a vessel, a red light goes off and you're not supposed to push it in. So it guides you. You're ready to fire. It's green, you're safe. If it's red, you're not safe.
Interesting.
Very fascinating technologies.
Yeah.
And again, I'm just being exposed to them. I think it's fascinating. I'm going to learn more. I'm very interested. The second one I just told you about comes out of MGH and Rox Anderson's area, so that's a serious deal.
Yeah.
And I'm going to look into it because whenever we can improve safety, that's key for the future. However, hold on.
Yeah, we'll take a look, and I'd love to see what you're pulling out.
I'm going to talk about something else.
Okay.
So we talk about the lowering of the average age of the consumer use the term medical aesthetics.
Yes.
David Pyatt invented that word. He was on the program. He actually invented the word medical aesthetics. I didn't know that until he was on the program. And I verified it subsequently. So medical aesthetics, and we all say it, that's David's. Okay. We're lowering the average age. We changed from, we used to say rejuvenation. People were 45 to 50. I would even argue 50 and plus.
Yeah, exactly.
And now you say 30, 35. I got 25-year-old patients, and we're calling it prejuvenation, as you know.
Yep,
so
exactly.
not only has the average age gone down, but the terminology has changed.
Yeah.
We're prejuvenated.
Yeah.
I don't want to look like mom and dad.
Yeah, they want to avoid the problem.
They
don't
want
want to have to
they don't
ever
want to
treat
look
it.
like us.
Yeah, exactly.
Okay.
Yep.
And the male market is expanding.
Yep.
We can talk about that, but in any event, the male market is expanding. Still, the preponderance is women, about 80 to 95, depending on which study you believe.
Yep.
And people are taking more active interest. This is, you said, they're taking more active interest in their appearance and their aesthetics and how they look, because how they look affects how they feel.
Exactly.
And people want to feel the best they can. It's
Yep.
not just about looking younger. In fact, I've argued this many times. People generally don't tell me they want to look younger. They just want to look better.
Yes. Yep.
And so that's a different argument, especially the
Yeah.
men.
Yeah.
Now, along with those ideas come home-based treatments, home care. It could be as simple as skincare, active skin ingredients. You know, you might be looking at a more aggressive or biologically active topical down the line that you're going to put on your face. But in addition to that, something like True Facial. Now, the inventor of True Facial is Dina. She was on the program. This is a True Facial home device. I used it today on myself.
Oh.
So once a week, Aaron and I have these here in Manhattan Beach and also in Sun Valley. Our family has them. We give them as gifts. It's amazing. It's a 3-step process. You know about hydrofacial, of course.
Yep.
It's like a home-based hydrofacial, okay? And I'm telling you, and I do have an interest in this, so yes, same shameless self-promotion. However, I'm going to send you one of these for Christmas, and I'm telling you, you're going to use them because you can put the serums in here. You can clean your skin. You can put, as microneedling is the last step. It's a great home-based technology that I'm sure 10 years ago I never would have picked up and used.
Yeah.
But Aaron and I do about once a week now, and it's simple. It's 10 minutes.
Yeah.
to
Looks
fix
like
it.
a very small hairdryer.
Yeah, there it is.
Yeah.
It's simple. You do it to yourself. I don't have time to go into it now. You can go to True Facial on Technology Beauty. Dina, the inventor, is on it. And I can't tell you which episode it is. But in any event, you
Great.
keep
I'll
your
check
ears
it out.
open
Yeah,
for
yeah,
this.
we'll do.
I thought you'd get a kick out of that.
Yeah.
Well, it's been an absolute delight to have you on the show.
Oh, my pleasure. So glad to get out here.
Finally,
Yeah.
finally.
Yeah.
I love it. So I want to see you and your wife out here, and we'll get together with Aaron,
Sounds
or
good.
come up to Sun Valley and see us again.
Perfect.
That would
Sounds
be great. Congratulations on all
Thank
the
you.
work you're doing. Keep it up.
Will do.
Keep pushing the envelope, Bob.
Will
What
do.
you're doing is really providing safer, more effective care. It used to be, a bunch of hand waving.
Yeah.
It was like a magic trick, and now it's science.
Yeah. Yep.
And safety, it was science.
Yeah.
Thanks to MERS and thanks to Bob Radigan. And
Thanks
I
for
want to
that.
thank all of you for joining me on this super exciting episode of the Technology of Beauty, where, as you see, I had the opportunity to interview the movers and shakers, a mover and shaker, probably the mover and shaker of the beauty business, Mr. Bob Radigan, the head honcho for MERS Aesthetics International. See ya every Tuesday, new program. Take care.